Welcome back. This is the fifth week of CBI's Falls Prevention Education Program. This week, we will be covering how sensory changes, such as vision and hearing loss, can increase the risk of falls among older adults. The main topics this week are sensory changes, vision, and hearing. Okay, let's get started. Sensory changes occur naturally with age and occur with other conditions as well. Having a sensory deficit increases your risk of a fall, and having more than one increases that risk even further. And sensory loss can result in avoidance of activity, which leads to an increased fall risk. Women are more likely to experience vision loss, and men are more likely to experience hearing loss. Vision. Visual impairments affect balance and can increase risk of falls. People rely on visual cues for stability. The leading cause of visual impairment include cataracts, age-related macular degeneration, and glaucoma. Cataract surgery can significantly improve vision and reduce fall risk. Older adults may over-rely on vision as balance declines, but with visual loss, this becomes a problem. Loss of distance vision especially increases fall risk, and lack of contrast sensitivity can lead to a fall, such as inability to see the edge of a step or objects on the ground. A loss of depth perception increases the risk of a fall. You're unable to judge distances accurately, and having a decreased vision in one eye can be just as much of a risk as having decreased vision in both eyes, as you need both eyes for depth perception. Visual field loss is also a risk factor for falls, and a reduced ability to perceive moving visual stimuli can result in a fall. Peripheral vision is important for seeing changes in the ground surface, walking through a crowd, and navigating in traffic or seeing objects that are off to the side. People with diabetes are more likely to experience vision problems, and make sure your prescription is up to date and you wear appropriate glasses for each task. Wearing multifocal or progressive lenses can increase the risk of a fall because looking down through the lower lens impairs vision of the feet and ground immediately ahead. Talk to your eye doctor about wearing single focal lenses during walking or outdoor activities. Attend regular checkups with your optometrist to find out if there's anything you can do to improve your vision. Hearing. Hearing provides us with information about hazards around us that may cause a fall. The structures that allow us to hear are very close to the structures that provide balance, as they share the same nerves and blood supply. If our hearing is affected, our balance is most likely as well, and vice versa. Exposure to loud noises throughout the lifetime has an effect on both hearing and balance. Those with poor hearing have a higher fall risk because they have poor balance compared to those with good hearing. They are unable to hear incoming hazards. When they pay more attention to hearing, they pay less attention to balance and avoiding falls. Hearing loss has been associated with depression and social isolation, which are also risk factors for falls. And declining from normal to even mild hearing loss is associated with a significant increase in fall risk. Get your hearing checked out and use hearing aids if they have been prescribed to you. Alright, while this week's topic is relatively straightforward, it is also something we ourselves cannot help too much in. Make sure to emphasize that they should see their family physician or optometrist if they have any concern. As always, please feel free to email me if you have any questions or concerns. Thanks again for joining me, and have a great day.